Hi everyone. Today we are going to turn the corner and get into part 4 of our class, looking at how institutions relate to society and how institutions relate to our 5 subtopics, starting today by looking at how institutions relate to the social construction of reality. But before we move forward, just a quick recap of what we've been doing so far with respect to our course framework. First, we start to look at culture and society, the cultural foundations of social life, and how culture connects to our 5 subtopics. And then we got into the social psychological dimensions of social life and how social psychology ties into the subtopics. So keep in mind, basically the two, culture and social psychology, are connected. When we're exposed to cultural ways, when we learn and internalize those cultural ways, they become part of how we see ourselves. They become part about how we see other people. And just because we're all socialized in the same culture, it doesn't mean that we're all going to turn out to be the same people. So we still have individual differences when we're socialized in different subcultures. Think about Leroux and how she said, different subcultures are related to class, produced different social psychologies. And we also have that free will to go about navigating social life in our own ways. So that ties into Goffman when he says we can't decide if we're normal or not. Culture dictates normality, but we can navigate culture in our own ways through free will. So now turning our attention to the institutional part of the class, we can ask and then answer two questions. The first question is, how is culture produced? So if culture is so important because it provides people the rules of the game, because it shapes our social psychologies, where does it come from? We say culture does not appear out of thin air, doesn't come out of the blue. So how is culture produced? To answer that, we'll turn our attentions to institutions. And the second question, where do people internalize culture? Where do they make culture part of their social psychology? Again, to answer this question, we'll turn our attention to institutions. Moving to the fourth part of our class, we can start to conceptualize what we mean when we say an institution. So when we say an institution, we're talking about a major sphere of social life that is organized to meet certain human needs. So on the slide here, I give you a partial list of different institutions that will be part of all societies. So all societies are made up of social institutions, and these institutions may be arranged differently compared to one society or another, but they all fulfill the same functions. They're all organized to meet certain human needs. So, for example, the dominant religion of a society may be different from one place to another, but that religion still provides the same function by providing people an understanding of the unknown. What goes on after we die, you know, um, what goes on in terms of morality during our lives. So the same function, but perhaps a different religion when you look at different societies. So going back to how we define an institution, a major sphere of social life. So we're looking at a sphere of social life such as family, such as religion, media, the economy, government. And the spheres are organized. And so by organization, we're looking at a division of labor. A division of labor that comes with certain roles and responsibilities within the institution. So, looking at the family as an example, the parent and the child have different roles and responsibilities. The parent is supposed to provide care and nourishment for the kid. Then we can look at perhaps how children and families have other roles and responsibilities, such as doing certain chores inside, outside the home. Within religions, we have different religious leaders that carry different roles and responsibilities. Media, you have writers, producers. So again, everybody's kind of playing out their own role and responsibility attached to that role that ultimately makes up a division of labor and organization within the institution that makes the institution functional in the sense that it's there to meet certain human needs. So we talked about religion. We can get into the family. The family provides care and nourishment to individuals. The media provides individuals information, entertainment, and the economy is responsible for the production of goods and services, and government is responsible for providing law and order. We can now look at more general functions of social institutions. So institutions, whether it be the family or religion or education, institutions provide a social space in which we encounter and we learn a particular culture. So when we attend a religious service, when we go to school, when we're at home, or perhaps when we're playing a sport, we encounter and we begin to learn through that socialization process a certain culture. And so within those spaces, for the most part, we have what we call institutional agents that are teaching us the culture. So they're producing the ideas and the meanings that we're exposed to. It could be a parent, it could be a priest, a teacher in education, writers in the media, politicians in government. But we can also recognize how other people play a role in producing ideas and meanings and teaching those ideas and meanings, such as uh, your siblings in a family, your fellow churchgoers when you attend a religious service, your fellow students at school. So, what institutions do is they provide us a space in which we're learning a culture that is being produced and taught within that space. So, specifically, we can look at the space that we're learning culture. It could be the living room in the institution of a family. Again, it could be the religious building in which we're practicing our religion. It could be the classroom in which we're learning our education. So that's what we're talking about. The institution produces culture and it provides us spaces in which we are exposed to and we learn that culture, both formally and informally. Formally, we're getting a direct lesson about the ways of the world. Informally, perhaps we pick up the ideas, the meanings through observation, through more indirect learning. So, a third function of institutions, we can say, is institutions organize social relationships around different factors, such as our sex, our class, our race, and our age. So, for example, when we can drive, when we can vote, is based upon our age. Sometimes at universities, scholarships you can obtain, you can apply for, is based upon your race. How much you pay in taxes ties into your class background. And if you can enroll yourself in a certain sport league or not is often based upon your sex. Here is an overview of our 5 subtopics and the different readings we'll be looking at to illustrate the subtopics and how they tie into institutions. So today we'll get into how institutions, specifically government and medicine, tie into the social construction of reality. So how institutions help produce the realities in which we live. Then we'll turn our attention to leisure and play. And in doing so, we'll look at the connection between the economy as our institution and leisure activities. Then we'll turn attention to the subtopic of race and how race relates to the institution of the family. And then we'll look at the institution of education, with respect to the subtopic of gender. And then our final subtopic, social class, ties into our third book of the semester. We'll be looking at how social class ties into the criminal justice system. Here we can connect the dots of all three dimensions of our course framework, looking at the interplay among the three dimensions that come together to produce social life, to produce our subtopics. So we say institutions produce culture. So again, culture does not appear out of thin air. It doesn't appear out of the blue. Rather, institutions in a society, no matter kind of what society you're looking at, it's the institutions within those societies that are producing certain cultural ways. So here we are linking up institutions to culture. And then we look at how the institutions provide us those spaces, the living room, the classroom, the field, the spaces on which we are socialized. So we make that culture part of our social psychology. Here, linking institutions to social psychology. So here we start to see the three different dimensions all coming together at once, although they can't operate individually at the same time. Going over our first reading for the last part of our class, we're looking at how institutions tie into the social construction of reality. So not only are we looking at how an institution, or how two different institutions build a reality, we're also looking at how they recreate a reality. In other words, how they take kind of one reality and they change it through institutional changes. So we're looking at the question, is marijuana, is cannabis a medicine? And then we look at how during one time period, cannabis, as it was known, was seen as a very valuable, very effective medicine. But then institutions of government and medicine got involved, and they reorganized the understandings of now what's going to be understood as marijuana as something that is not a medicine. And so again, we're looking at how two different institutions come together to recreate the reality, to produce a new reality. So again, the question, is marijuana a valid, legitimate medicine, and how that changed over time? That can be seen in the chapter. And so the chapter provides us a little bit of kind of historical analysis of marijuana as medicine, as cannabis as a medicine. So keep in mind, the authors aren't trying to make any value judgments. Is marijuana good or bad? They're not really looking at it from that point of view here. They're simply providing the reader some historical background into marijuana as not a form of medicine. So we can divide this historical background into two different histories. We can call it the pre-demonization history, and then we can look at it in reference to the demonization. And we see kind of the change between histories as a result of institutional work, how institutions of government and medicine get involved, and through their different works, they change the meaning of marijuana, cannabis as a form of medicine. So looking at kind of the earlier historical period, ideas of medicine and government both were very fuzzy concepts. And by fuzzy concepts, we didn't see anything as being black and white in terms of medicine that you can use or you can't use to treat a symptom, to treat an illness. And the same kind of fuzziness is applied to those who practice medicine. So we didn't have at this time any medical schools, any formalized training that you needed to go through to practice medicine. So at this time, both medicine and those who practice medicine were fuzzy concepts. If you wanted to use something to treat a symptom, if you wanted to use something to treat an illness, it was your right, it was your decision to use it or not. You didn't have any institution, such as the AMA, to tell you that you can use it or you can't use it as a form of medicine. Likewise, you didn't have any formal body telling you that this person can or this person can't practice medicine. So you saw people such as midwives, different kind of shawl women, shawl men, and just family members in general who've had experience kind of treating people, whether it be their own family members or other community members, that would practice medicine, although they didn't carry a certain credential that said that they could, or they didn't lack a credential that said that they couldn't. And so we'll see that how that changes here in the demonization period. But before we move there, staying within the same pre-demonization, when looking at the value of marijuana, what is known during this earlier time as cannabis, as a form of medicine, it was seen as possessing high value. Not only was it effective in terms of treating symptoms, it was also effective in terms of how many different types of illnesses, how many different types of symptoms it could actually treat. So if you go through the chapter, it provides us, a laundry list of a sort that says, marijuana, cannabis at this time was used to treat, things from head to toe. Treating fevers, treating headaches, treating depression, treating breathing issues, treating stomach issues, such as diarrhea. It talks about treating arthritis. And so again, this is kind of, you see that marijuana was seen to be highly useful because you could use it to treat things, and it was very effective in the treatment, but you could also use it to treat a lot of different things. So moving down to the stereotypical user. So, it is recognized that some people could maybe abuse the medicine. So maybe use it too much or use the medicine when it really wasn't needed. And so the stereotypical user at this time, the user that came to mind, that popped into your head when you thought about somebody who's maybe using or abusing cannabis, it was a white middle-class woman. And so here, the idea sometimes relates to maybe the bored housewife or something like that who today maybe is associated with using pills, being a pill popper or something like that. But back in this earlier period, it was the kind of white middle-class woman that was seen as a stereotypical user, abuser of cannabis. And in addition to the stereotypical user being the white middle-class woman, how we saw this person was with more sympathy, because we saw the abuse being an issue of health rather than a criminal issue that we see it being associated with later on. So you take a more sympathetic approach to the abuser because we see it as a health issue that needs to be responded to as such. So now we'll move to the later, more recent history, the demonization, and see how the reality behind cannabis / marijuana as a form of medicine changes. So first, what we see is the formalization of the ideas of what medicine is not, who a doctor is, who a doctor is not. So now we have institutions, government, medicine, coming together to formally say that you can use this or you can't use this as a form of medicine, and telling us that you can or can't practice medicine. So we have doctors, we have medicine, in very black and white ways for the first time as a result of the institutional work being done by government and medicine. So going down to the value of marijuana as a form of medicine, now we start to say that compared to the past, where it was seen as having high value, now it is seen as having no value, perhaps even doing something negative to the patient. So again, this doesn't happen overnight. When people kind of know things in one way, you can't really change their way of thinking quickly. It takes time and it takes effort. And so we saw some of these efforts being how they did change the name of cannabis to marijuana. Because when you associated positive things with cannabis being of high value, you had to kind of relabel it to start to stigmatize it, to attach negative meanings to it. So you change the name from cannabis to marijuana, and with the new label, you start to put new meanings on it. Marijuana doesn't carry any value as a medicine. Marijuana can actually harm the user. In addition, you outlaw people practicing marijuana as a medicine. You make it illegal to do any research on the usefulness of marijuana as a form of medicine. So again, the institutional work being done starts to say that you can't even research it, you can't use it as a form of medicine. It's illegal to use overall. So again, you start to have people think about it as, they wouldn't make it illegal, you wouldn't outlaw it if it was something good, thus it must be something bad. And so, in addition to the institutional work being done to change the value attached to marijuana as medicine, you also see a change of who is seen to be the stereotypical user. So now, corresponding with the kind of little value, the stigmatization that was done on marijuana, you start to see racial minorities, people from lower class backgrounds, and men being associated with the use and abuse of the drug. And not only do you see kind of a, culturally speaking, a more scary stereotypical user, because the white middle class woman doesn't really scare anybody. But here you see kind of the scarier racial minority, lower class male being the stereotypical user. The user is seen now as a criminal rather than somebody who has a health issue. So before, when marijuana abuse was seen as a health concern, now marijuana use and abuse is seen as a criminal concern. To conclude, again, what we saw is how social institutions, specifically the government and medicine, operate to construct social reality as a whole. They redefine the what in terms of, what is medicine, what is not. They redefine the who in terms of who can and who cannot practice medicine. And in addition, they change the value associated with the usefulness of marijuana as medicine. Before, it was seen as having high value. Now it's seen as having a lower value. And in addition, the institutions work to change the idea of the stereotypical user. And so the new stereotypical user fits much better the new stigma attached to marijuana. So now we can look at the piece you're reading in reference to all three pieces of our course framework. And so we can understand the recreation of reality of marijuana as medicine with reference to all three dimensions of our course framework. The institutions doing institutional work, government and medicine begin to change the culture by changing the name from cannabis to marijuana and changing the meanings associated with each. The positive meanings are changed to negative meanings. You change, again, that stereotypical user from somebody who is seen as sympathetic, not harmful, to somebody who's seen as a criminal to potentially harmful. And then overall, you're just kind of stigmatizing marijuana, making it seen as something demon-like, something bad, and then you make it illegal. You outlaw it in terms of the use of it. You outlaw the research of it. So overall, you kind of redefining it as something bad and something negative compared to earlier when it was seen as something good, something positive. And once people are exposed and re-exposed to this new culture, we learn the new culture, we learn the new meanings, and people start to see marijuana as something negative. People start to see it as something bad rather than positive, beneficial. So those two kind of histories. We can understand how the history changes, not by itself, but changes as a result of institutional changes. And we could update this chapter to maybe look at our current reflections of how marijuana can be used as medicine. Because again, I think the tide has changed with more and more states legalizing it in terms of medical use, legalizing marijuana in terms of recreational use. To understand these newer changes, again, we have to understand the role of institutions. When our government is now telling people that it's okay to use as a form of medicine, it's okay to use it recreationally, then again, we start to change the culture around it, and we start to change the way we think about it. We can also look at the economy and how the economy has begun to embrace marijuana as a form of revenue, whether it be recreational use or medical use. So again, the changing position of the economy changes the way we think about it as people, changes the culture overall. So again, we can explain kind of our newer changes of marijuana as something good or something bad with reference to institutional changes that have changed the culture around it in a more positive way. Thus, people, we're not trying to say they'd be more likely to use it today or not, but at least the way we think about it is different today, a reflection of our newer culture compared to the past one that stigmatized it, that demonized it much heavier.